Hello, I'm Dr. Michael Steele and welcome to my YouTube video. My topic for today is do not resuscitate orders. I'm really trying to outdo the boringness of my first video, so we'll see how it goes. Before I get into that though, I just want to give you my advice on who I think you should vote for this next presidential election coming up. Just kidding. I'm just going to stick to things I actually know something about. I know nothing about politics, so all I can say about the next election is good luck, America. I love America. Yay. For those of you who don't know, which I would assume is everybody because this is only my second YouTube video, I'm a board certified internal medicine physician currently in practice, so I see patients every day, and I chose this topic because I go over it quite a bit. There's sort of this speech on the topic that I keep finding myself making over and over again in the office, so I assume there must be some kind of interest out there, and I just kind of want to make that information available to people generally. So what are we even talking about when we talk about do not resuscitate, or DNR as I'll refer to it from now on, just to be more succinct. DNR is an order that's available to you if you're at the place in your life where something very bad were to happen to you, so that you're basically dead, that you don't want to be brought back. So at least in the state of Washington, a DNR order only applies when your heart is stopped and you're not breathing and you're dead. It does not apply to when you are still alive. As such, it is different from advanced directives. Advanced directives can include a DNR order, but advanced directives generally refer to the limitations you would want on your health care if you are still alive but you can't make decisions for yourself. Like, let's say you're in a coma because of a stroke and you don't want to be kept alive artificially in that state. Similarly, a DNR order is not the same as going on to hospice, and it's not the same as choosing comfort care measures for yourself. This can actually cause considerable confusion because a lot of people will say, well, I would want to be resuscitated if there's a good chance I can make it. Unfortunately, in a DNR situation, we don't have that luxury. That sort of caveat is for advanced directives, where you are still alive and we're trying to keep you alive. In a DNR situation, you are already dead, as I mentioned above. I mean, you're dead. So your prognosis is automatically very, very, very bad. And the question is, right now, right this second, without knowing anything about what made you sick or what your chances are of making it, are we going to go ahead and attempt CPR and to resuscitate you? So it's just a simple yes or no. In the situation where your heart stops, would you want us to try to bring you back? As far as why you would even want to be DNR, unfortunately, I've seen a lot of people pass away. I have a lot of elderly in my practice, so I'm a little bit experienced in this arena, unfortunately. A lot of people kind of have this notion that when they die, they would like it to be peaceful and quiet and comfortable and surrounded by their family and friends at home, hopefully. Or people think, well, I'd like to die suddenly and without much suffering. As it turns out, though, this scenario is almost impossible if you don't have a DNR because of the way our medical system is set up. What typically transpires when a fatal event occurs, whether it's a sudden heart attack or a stroke or what have you, is you're found down and the paramedics are summoned and they arrive on scene and evaluate you. And if you have no pulse and you're not breathing, their job is to provide CPR. So they will do chest compressions and they will attempt to shock you and then put a tube down your throat and give you oxygen. Then it's off to the emergency room, and if they're successful in resuscitating your heart, then off to the ICU normally, where you're on the ventilator machine. That's what the medical team is supposed to do in that situation, unless you have a valid DNR order. Hopefully at that point you're able to make a full recovery, but if you are at the end of life, typically that's not possible. And what happens is it falls to a family member to have to make the very difficult decision to withdraw life support. Now, I'm definitely not trying to scare anybody. I just want you to be aware that this is how things commonly unfold at the end of life, because I know most of us don't have a lot of experience about what dying looks like and how it actually goes. This is not the only scenario, but you can ask any internist that they have seen this many, many times. I don't have any specific numbers, unfortunately, but I've heard it estimated that if you're over 80 years old, the chance of you successfully surviving an event requiring CPR to where you're able to get out of the hospital and walk and talk on your own and get back to the same quality of life that you have now, the chances of that, unfortunately, are very slim, like less than 1%. Now, I do have plenty of patients who it doesn't matter how slim the chances are that they will be resuscitated. They want to take that chance. They want to have CPR and give it a go. And that is perfectly fine if that's what you want. That is a very personal choice about a very serious matter. And it is important for all doctors to be respectful of your decision, no matter what you choose for yourself. Now, I know some politically astute observer out there is going to accuse me of giving the Obamacare death panel speech. And, I don't know, maybe this is what they meant when they, whatever that whole hullabaloo was back then. But I'm just trying to give you the information so you can be aware of what's going on. You can make good decisions about your healthcare. I'm certainly not trying to scare anybody or force anyone into choosing a DNR order or choosing to limit your healthcare otherwise. So just to summarize and kind of put everything in perspective, if you are nearing the end of your life, you need to be aware that something is eventually going to kill you. It happens to all of us. And if you're at the point where if that were to happen, you would rather just be let go and let nature take its course, then resuscitation efforts like CPR may be unwanted, unnecessary, and quite frankly, unlikely to give you any additional meaningful quality of life. So a DNR order is just simply a way for you to have a little more control at the end of your life and avoid that unwanted attention of CPR if that is indeed a goal for how you would like to pass out of this world. So just a few more things, just very briefly to wrap up this subject. If you want to be DNR in the state of Washington, you should have a form called a POLST form, P-O-L-S-T, filled out and signed by your doctor to have a valid order. I believe there are similar forms in other states which serve the same purpose. And I'd also mention if you are going to be DNR, you really should talk it over with your family, because if this becomes an issue, you'd really like to have everyone on the same page. Hopefully it won't be an issue anytime soon for most of us. So I know this has been a very serious subject, and I apologize that I wasn't able to find a way to make it really entertaining or not boring. But I do hope it is helpful for you and you find it useful for making your own informed medical choices. Until next time, take care.